Lots of folks know that exercise is a great way to prevent atrial fib. In fact, there are several ways to prevent atrial fibrillation. Manage your diabetes or insulin resistance if you have it. Keep your weight down. Decrease obesity. Manage your blood pressure. So obviously, exercise, and especially high-intensity interval training, would really help, and it does help in terms of preventing atrial fib. Well, what's the impact on once you have atrial fib? There's actually been a couple of studies on that. We're going to talk about one of them today. It's by a group led by Dr. Malmo, M-A-L-M-O. It was published in January 2016. It has a lot to say about atrial fib for exercise for those that already have significant atrial fibrillation. But before we get into that, just a quick introduction. Ford Brewer, Prevmed Heart Attack and Risk Disability Prevention. Now, just a couple of reminders about atrial fib. It is a major risk factor for stroke. Heart attack, yes, but especially for stroke. So atrial fibrillation is a very important thing. In fact, it is the most common type of dysrhythmia or arrhythmia. Just as a reminder, here's a cross-section diagram of a heart, and here's what atrial fib is. Basically, the pacer of the heart is up in the atria, and if you get a circular pattern, then you just get chaotic beats up here in the atria, and then the ventricles have a hard time following. It goes too fast for the ventricles to follow. So you get some significant challenges in terms of the electrical pattern. You can get a heart rate up to 150, 160. That's classically what you'll find. And some decrease in the what we call the preload of the ventricles because of no coordinated function of the atria, leading to a decreased cardiac output. But again, what we're looking at here and what we're concerned about is prevention of strokes. If you have that chaotic function in the atria, you can get, the theory is anyway, that you get clots in the atria that form. Now, let's go back and talk about atrial fib and exercise. That's actually supposed to be part one, Malmo and Al. So Malmo and associates were in Norway. This study was published in Circulation in January of 2016. What they did was take 51 patients with atrial fib. These patients had persistent or paroxysmal atrial fib. They were being referred for ablation. So these people had symptomatic atrial fib. What they did was they put them on a loop recorder looking for episodes of atrial fib. A loop recorder was basically implanted. It's implanted under the skin, and it records. And when an atrial fib episode starts, then the loop starts. Now, what they did was they took, these people had an average BMI of 28, so they were heavy, but not morbidly obese. 26 patients were randomized to a 12-week aerobic interval training, and we'll talk about what that means a little bit later. The remaining 25 were told to just do whatever your routine is. If you do exercise, then do it. If you don't, then don't. And do whatever your exercise pattern is. So, here are the, again, 12 weeks of randomization, and here are the results. The control group increased in their time of atrial fib from 10% up to 14%, as recorded on the loop recorders. The interval training group decreased their time from 8% down to 4%. Significant improvement associated with interval training, what they called interval training, and I think what most of the rest of us would call high-intensity interval training. So that's decreased time in that by the loop recorder, but how did they feel? Well, here was the reported quality of life and symptoms. The folks with interval training had fewer AFib episodes. In other words, I haven't had as the folks in the interval training period reported, I'm not getting as many intervals, I'm not getting as many episodes of atrial fib. And when I do get an episode, it's less intense and I have fewer symptoms with it. That group with the interval training also had a 5-pound weight loss. They had improved cholesterol indicators, lipid indicators, and improved atrial function. So this was a group that was really benefited, and these people had active atrial fib. Now, what were we talking about here? Some running or walking on a treadmill. And the image here, I think, is obvious. The image here has been, you get weight loss with interval training. But let's look at what that Malmo and that group did. So what was the regime that they put these folks through? Walk or run 3 times weekly on a treadmill. 10-minute warm-up, 60 to 70% max heart rate. Then go to, and with max heart rate being 220 minus age. So then if you're doing 60 to 70% of that, just multiply those out. If you're doing 85 to 95%, multiply those out. So a 10-minute warm-up at 60 to 75%, or 60 to 70% maximum heart rate. 4 minutes of intensity, followed by 3 minutes of recovery. The intensity was 85 to 95% of the heart rate, and the recovery periods were 60 to 70% of the heart rate, max heart rate. How many cycles? 4 interval cycles. So here you go, 10 minutes warm up, 4 cycles with 7 minutes each cycle. So that's 10, well, the intervals was 7 times 4, that's 28, plus 10, that's 38 minutes, and then a cool down. So we're talking about a little over half an hour 3 times a week. Now, were they waiting to see if the patients had no atrial fib? No. Whether they were in or out of the atrial fib episode, they went ahead with the work, the study, the interval training. So that makes a loud statement too. Those of us who have had atrial fib, go ahead and exercise even if you're having an episode. At least that's what these folks did. So again, significant improvement on exercise, high intensity interval exercise when you have atrial fib. Thank you.